I'm Dr. David Biedebach with Canal Chiropractic Relief Center. Today I want to talk about migraines and headaches. Very common in our society. Many people have them daily, several times a day. Some have them many times a week or throughout the month. Much of the headache problem is due to an upper cervical spine problem. Not all of them, but many of them. And upper cervical spine is right here in the neck, and they frequently will come from an old fender bender somebody had a long time ago. A little motor vehicle accident didn't seem like a big deal, or maybe it was, but it altered the mechanism of how the neck works. UCLA says 12 miles an hour can change the mechanics. More recent study is Yale saying 8.6 miles per hour can do it. It seems like nothing, but at 2.5 times the whip, it's significant. When it changes the mechanism, it changes the wear. So frequently, upper cervical spine, C1, tends to overwork to compensate. That nerve in the medical books will show you that it goes to the vascular supply of the head, the pituitary gland, scalp, the facial bones, brain, inner and middle ear, and the sympathetic nervous system, which is very important. So just like sciatica, if you pinch that nerve, you can get pain down the leg. When you irritate this nerve, you can get these symptoms, and it will say this in the neurology section of Gray's Anatomy and many medical books, all medical books, that it can cause headaches, anxiety, nervousness, migraines, and a few other things. Nobody I've ever seen got them all, but they usually get 1 or 2, sometimes 3. So when this irritation continues, it takes less stress to excite the muscles because they're already overworking, which irritates the nerve. So what can you do? Some of the things you can do is simple stretches on a daily basis. You can also do a self-massage through the upper portion of the neck. Not hard, not aggressive, just light and diffuse for about 30 seconds to 45 seconds. Why? You're picking up the circulation into the area, then you're going to ice it and relax and get the muscles to flush out, and then hopefully back off the pinching mechanism before it gets worse. All right? Now, you also want to drink a full glass of water, because just like when you go to the masseuse, they will tell you drink water, because when they're working on the muscles, they're dumping the lactic acid through your system. It goes into the stomach, lowers the pH, and people can feel nauseous. And if they do a big enough massage and have enough cramping going on, sometimes they can even be worse than that. But with this, I've never seen it more than a little nausea, but you take the water, it knocks it out completely. That might work for you right away. It might not. But it is something that you can try to see if it doesn't help you. Seeing a chiropractor is an excellent idea, because it's one of the top 3 things that we see and is incredibly successful with the treatment. Once you see an x-ray, you'll see in the first day whether or not it even has an effect on the likelihood of an effect based on the mechanics. I'm Dr. David Biedebach. I hope this will help you. If not, please contact us, and I'd be happy to help you further, because most people respond in a way that is significant in this frequency of the headaches, to the extent in some cases not at all, other than a real normal circumstance, which is very occasional. Dr. David Biedebach, Canal Chiropractic Relief Center. Thank you.